Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
What is animal chiropractic? Hi everyone, and welcome to Animal Chiropractic Clinic Chatter. This is Dr. O, and today we're going to clear up a common question. What's the difference between veterinary chiropractic and traditional veterinary care? Animal chiropractic is a specialized field that focuses on the alignment and function of the spine and joints in animals, especially how these affect the nervous system. Just like in humans, when an animal's spine is misaligned, it can cause discomfort, reduce mobility, or even impact organ function due to nerve interference. Now, how does this differ from what your traditional veterinarian does? Veterinary care is broad. Vets handle diagnostics, surgeries, vaccinations, medications, internal diseases, the full spectrum of animal health. They are trained to address infections, injuries, and illnesses, often using pharmaceuticals or surgical interventions. In contrast, animal chiropractors, often doctors of chiropractic with specialized training in animals, focus solely on the musculoskeletal and nervous systems. Our goal is to restore movement, improve function, and support the body's natural ability to heal, all without drugs or surgery. But here's the important part. We're not in competition. We're collaborators. Veterinary chiropractic is a complementary form of care, not a replacement. In fact, the best outcomes happen when chiropractors and veterinarians work together. For example, a vet may treat a dog for hip dysplasia with medication, while the animal chiropractor helps improve joint function and reduce compensatory stress on the spine. In many places, including here, animal chiropractors are required to work under veterinary referral or in coordination with a licensed vet, and for good reason. It's about protecting the animal's overall well-being through teamwork. So the next time your pet seems uncomfortable or stiff, remember, your vet can help diagnose and treat illness, and your animal chiropractor can help keep their body aligned and functioning well. And that is what animal chiropractic is all about. So keep those atlases adjusted. Remember, the body heals one way only, above, down, inside, and out. Have a great day.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book, Yes, It's Really a Thing.
What is going on, everyone? My name is Stan Smith. I'm the CEO of X-Dog, and the inventor of the X-Dog Weight and Fitness Vest. What is the X-Dog Weight and Fitness Vest? In a nutshell, it is the world's greatest harness for dogs. It doesn't matter what you're doing. If you're looking to build muscle, combat obesity, address anxiety issues, high energy, you want to suppress that energy level. If you just want to take the average walk and turning into a health improving workout, we made it so convenient to exercise your dog that you literally only need about 30 seconds a day. It doesn't matter if you're doing basic obedience training or compete at high level dog sports or in protection sports. The X-Dog Weight and Fitness Vest can enhance it and take any type of daily lifestyle to the next level. If you want to be part of our mission of eliminating canine obesity or just being a part of our team, make sure you go to teamxdog.com. As always, man, I want to thank you for your time and your support, and Team X-Dog strong.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Your active dog needs more than water to rehydrate. Replenish Dog Water Supplement is an all-natural powdered water flavoring, prevents dehydration and provides vitamins for your dog. Created by a veterinarian and rooted in science. Give your dog the care they deserve with Replenish.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hey everybody, welcome to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O, and today I'm here with Dr. Walsh. Tell us a little bit about yourself and your practice, ma'am.
I live in Houston. I've been a veterinarian since 2013. I went to ACEs, it's been about 3 years now, or started it probably 4 years ago, finished in a year. So I've been practicing chiropractic for about 3 years, and I do regular vet med on some days, and some days I just do chiropractic, and it's been going great.
All right. What's your biggest win with animal chiropractic?
Biggest win is when the owners and the technicians get to see animals come in that are either in so much pain, or they can't walk, or they're paraplegic, or have paraparalysis, and then they walk out of my clinic completely fine.
How often does that happen?
Pretty frequently. I get a lot of people that are referred to neuro, obviously, but the local neurologists sometimes are just not in their price range, so then they come and find me, and it's amazing how many do great, which is chiropractic, and don't need any other care.
Yeah, wouldn't that be cool if they all were referred to chiropractic first and then neurology if it didn't work?
Yes, that would probably be the better route, but yeah,
and just imagine what that would do to people's confidence in vet med.
Yeah, no, it's true. People would probably prefer to try something more less invasive and cheaper first.
Yeah, less expensive. I mean, well, insurance doesn't cover chiropractic. Well, still, even the deductible.
Some of them do. I've had people submitting my invasives to insurance. Yeah.
Yeah, and some of it does cover. Yep, you're right. How has it changed your practice attitude?
So it gives me a completely different tool to use, which is awesome. It's a lot of the times I'm using chiropractic. Before, I was just doing Rimadyl or carprofen and rest. So now I'm able to look at things in a completely different way and use chiropractic for probably a half to 3/4 of those that I would give anti-inflammatories to. So it's a great, healthier, quicker tool that I have in my tool belt for treating.
Cool. What would you tell like other veterinarians that are thinking about adding animal chiropractic?
Well, I mean, obviously, if we go into veterinary medicine, we want to help animals. So it's a great way to also help our patients and make your clients happy because you fix things almost instantly right in front of them. They think it's so cool. And then it also provides, like I usually nowadays, I don't work as much because I can work a half day doing chiropractic and make just as much as I can make in a full day of doing veterinary medicine. So it's helped my schedule too with my family that I don't have to work as much.
There we go. That's kind of nice, isn't it? And how do the kids like that?
Oh yeah, no, it's great. Because I'm home for school pickup and I'm home a lot more. And I'm not as stressed out when I get home as when I'm in a regular clinic.
We had one doctor that her kids would like when they got to leave to go to the morning and for school, that they realized after like about a month, if the bail wasn't in the truck, then mom would pick them up.
Oh,
it's going to be a long day. And so they were like, we need to take this with us, mom, every day.
Oh, I meant mom was home earlier. That's cute.
So they learned that the adjusting bail was the key.
Yeah. Yeah, no, that makes sense. Kids are smart like that.
What do you wish all your animal owners knew about animal chiropractic?
I wish they knew to start at a younger age because I usually see them when they're geriatric or they can't walk or they're in a lot of pain. So I mean, it'd be great if people all brought their pets in since they were a puppy and just did regular adjustments from the beginning. I think it would save a lot of vet visits and a lot of money in the long run. But it's hard to think about that when you have a young, healthy dog.
Well, but if we could just change, they all know they have to have wellness visits. They have to have your annual exam.
Yeah, that's true.
And, we got to go get all this stuff. And so maybe just add chiropractic as a part to that would be a huge benefit.
It would be being part of the annual exam, and that would be a great addition.
Well, and think about it, even your how often do you find something on one of your regular chiropractic patients that would be blown way out of proportion if because you found it earlier than you would have as a regular veterinarian because you see them more often?
Yeah, no, it's true. Or things that turn into like discus spondylosis or arthritis could have probably been slowed down if they were adjusted earlier.
Yeah. Well, not only the musculoskeletal things, but like even the minor tumors that we notice a lot of times because we have our hands on the dogs. Mm-hmm. And like most of my patients, I see once every month or once every other month after they get to maintenance. And, hey, we need to look at this. We need to keep an eye on this. We need to do something about this. And they're like, what? And you're like, well, this lump on the side here. And they're, oh, I never noticed that.
Oh, yeah. No, that's a good point. It's more frequent rechecks. That's very true.
Yeah. And we have our hands. So a lot of times we find stuff that we're able to take care of before it becomes bigger problems,
Yeah. No, that's a good point.
Because we do see them earlier. And then, people ask all the time about, well, what about cancer and all these things? We don't necessarily treat those, but the rest of the body is able to function better when it's well adjusted.
Yeah.
And so that's a huge difference right there.
That is true. I have caught some things because we're just looking at them a lot, or you're looking at them a lot closer. And then on a regular physical exam, we're doing all the heartworms, the vaccines, and you're just kind of like getting through all the things. I have caught some like lumps and bumps that I am like, you should probably have your vet look at that. Or like there sometimes will be different sizes. Like this happened multiple times. Their thighs will be different sizes. And we kind of just assume it was due to not using that side of the body more. You're just muscle atrophy. And then it turns out there's actually a tumor, a growth on the other side that looked bigger, and it wasn't just disuse. So that's happened actually a couple times.
Yeah. Yeah. And so sometimes you can find things that, would have and take care of them, or at least know about them before they're in an emergency room,
Yeah, that's true.
Because, having a tumor looked at by your veterinarian during regular hours is a whole lot cheaper than having somebody find that at 2:00 on a Saturday morning.
Sure. Very true.
So, anyway, how do you find many people are resistant to chiropractic? Or
So a lot of people, the people that get adjusted a lot themselves are not resistant to it. The people that have never been adjusted themselves and have watched a lot of TikTok videos are very worried about it, because there's a lot of weird TikTok videos out there that add all these cracking sounds, and it looks cool and scary at the same time. And so that's what people are expecting when I'm doing adjustment. But I tell them, like, all the adjustments I've seen on TikTok are not ABCA adjustments. I've never seen those. And then I think they're just, it's probably not as exciting as they think it is, because there's not all the cracking and loud noises when I actually do adjust them.
yeah, kind of disappointing.
Yeah.
Aren't you going to do that move? And I tell people, if your dog needs it, I will do that.
Yeah.
Yeah,
there's been a lot of crazy ones. They're like picking up animals and like pulling their sternum in. I don't know what they're doing.
I've never seen a dog that needs some of those TikTok adjustments, though. So,
there you go. That's a good point.
we're getting better without it. So let's see, what else? How about so the clients that are resistant, educating them, is it difficult or fairly simple?
I mean, yeah, I just have to talk them through a little bit, but they're usually fine with it. And I kind of walk them through the first few adjustments and be like, okay, I feel this, so I'm just going to push it back in place a little bit. And then I feel this, so I'm just going to gently massage it back in place. And then they're usually fine after they see their dog's fine. They're just looking at their dog's reaction. If their dog screams, they're going to panic, but
right. Yeah.
So once they see the dog's okay, they're usually fine with it.
Yeah. And every once in a while, we do have one that hurts, but I always will let the owner touch, and see that just touching is what makes the sore, not the actual adjustment,
Oh, that's a good point too. Yeah. If they're in a lot of pain, that is the trigger, is just touching it.
Yeah. So they've just never touched it in the right spot.
Yeah.
So anyway, all right. Well, you have some other products out there too. Did you want to talk about those a little bit?
I can. Well, I do. Yeah, I have a kind of a side supplement business, which Ace has been so kind to always pass out my kind of doggy Gatorade or doggy sports drink supplement. It's currently doing really well. Everyone really likes it. I get a lot of good feedback on it, thankfully. Y'all actually had a presentation of different things that help with recovery, and it was pretty much what I already put in my sports drink. But yes, there is one called Dr. Rachel's Replenish, and it's a powder you add to dog's water. I made it to prevent heat stroke because I live in Houston, where all the dogs get super hot out here, and they get hot and they pant and they're dehydrated. So if you're dehydrated and you pant, they can't blow off the heat from their blood vessels in their muzzle. So you have to rehydrate them so that the panting works effectively. But it also has ingredients in it that help with recovery. So I have a lot of sports athletes that use it. So your hunting dogs, your agility dogs, your dock diving dogs, and they've noticed a huge improvement. But one of the most common emails I get from people is their dogs will have really bad GI upset, or will have whelped puppies, or will just not be doing well. and they give them Replenish, and they just bounce back way quicker. So it does refeed the GI cells in dogs that are having GI issues or other kind of internal issues, and it helps them recover faster. So that is my biggest one. But my next one I'm working on is a HMB product, which stands for hydroxymethylbutyrate, which is something that helps. It's kind of a precursor to protein synthesis. And so that is going to help with dogs that are old and geriatric and losing muscle mass. In studies, it's shown to burn fat and gain muscle, even if you're laying in a bed for 10 days. So that's my next one I'm excited about.
All right. Well, we'll look forward to that. Because diet is so important in these dogs. And, you know, we have a lot of dogs that are eating what owners think is the best kibble around, but, you know.
Yeah, and I talk about diet a ton. I mean, you talked about it in class too. A lot of the dry kibble is so pro-inflammatory. But, I mean, it also depends on the owner's lifestyle. Right. Sometimes people just can't home cook food. There's just each case is a completely different case, but I do always try to push more kind of anti-inflammatory diets, because that's kind of the root of everything.
Yeah, you're right. I mean, we had one consulted with one the other day, and none of the anti-inflammatories are working for this dog. He's got a lot of pain, and even chiropractic's not helping this dog. But we switched to a commercially available raw food, which was easy for them to get. And within 2 weeks, boom, the dog has no pain, is on no anti-inflammatories, doesn't need anything else, because just there was that much inflammation in the body, you know. And I
believe it. I'm getting certified in food therapy right now, and I mean, it probably doesn't work as well in people, but in animals, you can feed them whatever you want, the same thing every day. You don't have to switch around their diet, so you can cater their diets to what will help them heal.
Right. Yeah. And, you know, I mean, think about it. If we were to eat, you know, I would not mind having a steak, grass-fed, grass-finished, you know, barely cooked steak with a salad and maybe a potato, you know. I could live on that, I think.
True. But maybe not every day like animals. You'd have to switch it up at least some point.
Maybe not.
No? Okay. Maybe not.
I think I'd be all right with that, you know. It might get a little boring but I don't think so. But yeah, and the other thing is, a lot of people are, but taste, you know, and dogs, smell is their biggest indicator of what they want to eat. You know, smell and texture are more important than taste, you know.
Yeah, well, especially for cats too, definitely.
Yep. So anyway, well, any parting words of wisdom?
Well, I think if people are thinking about adding chiropractic, they definitely should. It's blowing up. I have more patients than I have time to see. People are starting to try to find alternative or complementary therapies to regular medicine, and this is a great way to just help people take care of their dog, their pets, and actually save money. Sometimes I'll feel bad how much I charge for an exam or like an adjustment, but then I think about how much that MRI was going to be that they were going to get. So it saves them a ton of money in the long run.
Yeah, you can do a lot of chiropractic visits for an MRI. So you bet. All right. Well, everybody out there, remember, the body heals one way and one way only: above, down, inside out. Keep those atlases adjusted.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.